watching The Pulse, your weekly guide to global health on Al Jazeera. I'm Shireen Al-Feki. In today's program, we're looking at the drive to eliminate two of the most common infectious diseases in the developing world. We begin with polio, once the scourge of rich and poor alike. Now, thanks to a mass vaccination campaign, 70% of the world's children now live in polio-free countries. That's up from 10% just 20 years ago. Today, polio is rooted in only a handful of countries, but flushing it out of these remaining strongholds is incredibly difficult. Here's our report. Polio is a big problem in parts of the developing world. But it's a thing of the past in rich countries. The virus which causes polio spreads easily through contaminated feces. Many children are infected, but only 1 in 100 go on to develop disease. However, the impact can be devastating. Polio can invade the central nervous system, leading to paralysis of the legs or even lungs. In the 1950s and 60s, 2 vaccines from American researchers Jonas Salk and Albert Sabin revolutionized the approach to polio, allowing protection against this childhood curse. The result was a dramatic decline in polio, especially in the developed world. But by the late 1980s, 350,000 children were still being paralyzed by polio every year, mainly in developing countries. In 1988, the World Health Organization, backed by the charity Rotary International, launched a massive campaign to eliminate polio by the year 2000. Since then, billions of children have been vaccinated. The number of cases is now down to a few hundred a year. But the virus persists in 4 countries: Nigeria, India, Pakistan, and Afghanistan. And while polio survives anywhere, it can spread anywhere.
The dangers of this perception, and you read it in some of the scientific journals, that polio has done a great job, we're down to a few hundred cases, let's just leave it at that and start tackling HIV. And I think that message has got to go out that in 5 years, we're not going to have 300 cases. We're not going to have 3,000 cases. We are going to have 300,000 children being paralyzed by polio again if we don't get finished. It's an epidemic-prone disease, and that's why I think, you're getting that message out is going to be critical. Epidemic-prone diseases we have a pressure cooker. The pressures, we're sitting on the lid of this thing, and it either gets stopped or it blows off.
Bruce Aylward is chief of the polio eradication campaign, headquartered in Geneva. His colleague, David Heyman, is spearheading the final push. It's a race to beat the virus before fatigue sets in, among those in the front line of delivering vaccines and those behind the scenes paying for them.
This polio eradication initiative has cost over $3 billion. We've got to now finish the job so those resources can go to other health priorities: AIDS, malaria, TB, measles, other diseases that are also very important in economic development.
While the battle against polio is still being fought on the ground, scientists are looking ahead to the day when it will be a thing of the past. Once there are no more cases, eventually vaccination can end. The final step will be to destroy the stocks of polio virus held in labs around the world. And that includes the archive here at the Centers for Disease Control in the United States. For safety's sake, the plan is that the virus should exist only as a genetic blueprint stored on computers, so that it can be brought back to life if ever needed.
The deadlines now that are imposed on this program are not driven by declarations not driven by humans. It's driven more by the biology of the virus and by our ability to sustain the effort over years in West Africa in particular, but elsewhere as well. And so that, I think, heightens a sense of urgency to complete the task now while we have the virus nearly cornered. The tragedy, as we see it, is that this should have been finished by now.
Joining me in the studio to discuss the final push against polio is Naveed Sadeghi from the World Health Organization. Naveed, first we had a target of 2000 to eradicate polio. Then it was 2005. Come and gone. Is there a new target?
Well, Shireen, thank you for having me here. And, well, let me give you the perspective. We are talking of one of the most successful public health initiatives in the past 25 years. We are talking of saving up to 5 million children from death and lifelong disability so far. Yes, we had a target. In 1988, a target was set, and I think that was brilliant. It was critical to have a date around which you could rally the countries to support, to raise the financial resources, to get levels of commitment of the leadership, to inspire them. And I think it worked very well.
So what now? Is there a new target?
I think we have only a few areas in 4 countries left. Out of the 125 countries, there are only 4 countries which have a limited area endemic. Setting a target now would be counterproductive. These countries are really at it. The eradication is on track, provided we have the financial resources made available to them.
So what are we talking about? Another 10 years? Another 15 years? I mean,
Not
is
at
there a
all.
date? Is there a date?
There are milestones now, and those milestones are being achieved. Already the countries have cut the districts which were infected by half in the past 6 to 8 months.
So we've moved from targets to milestones.
We have moved to milestones for the reason that we don't want to give any laxity to the work that these countries are doing at the moment. They've formidable challenges, and they're overcoming those challenges.
Now, one of the reasons that 2000 and 2005 targets weren't met is that polio has popped up in places.
Yes.
And you've actually worked in 3 of the 4 hotspots. Can you give me an update on what's happening in Afghanistan?
Sure. I think Afghanistan has done a remarkable job. The entire country is almost clear. It's only a few districts in the south which have polio infections. Unfortunately, primarily due to the lack of access, it's difficult to access these children because of the ongoing conflict there in that country. And then in the neighboring parts of Pakistan, in the border areas of Pakistan and Afghanistan. And that's where these trickle of cases are in these 2 countries.
So as long as you can get in when you can get
Yes.
armistices or ceasefires or at least political commitment to get in.
Political commitment and some days of peace, some days of tranquility, yes.
Okay.
And that's what we are working on, working with the local leadership, working with the local conflict leadership to try to get these days of peace, days of tranquility where you can go in, get in, immunize the children, and try to make sure that this remaining reservoir, this remaining few areas are taken care of.
What about Nigeria, the other country, the other hotspot you've worked in?
Nigeria, again, the endemic area is only in the north. And there's been a tremendous improvement in the past 1 year. From, if I give you the figures for this year, for example, as of today or yesterday, there are 186 cases in Nigeria in the north only, as compared to 803 in the same corresponding year last year. It's a tremendous decrease.
Now, one of the issues in Nigeria, it's one thing to get the vaccine to people. It's quite another thing to get them to accept the vaccine. And of course, in Nigeria, there was the difficulty that many people turned against vaccination. And as a result, there was the rise in polio cases, and that then spread beyond Nigeria, through Africa, and then on to Asia. So what are you actually doing to get people to actually accept the vaccine?
Well, I think, again, in the larger perspective, there's been a good acceptance, and acceptance has increased. But let me tell you that this is not unique to polio. There's pockets of suspicion at times here or there. Every vaccination program has had to go through this, be it MMR here in United Kingdom or smallpox back in 60s. Whenever the number of cases start decreasing to a level which is when you're close to eradication, people initially don't feel the need for immunization. That's one. Or if there are other agendas, some people can raise rumors, and if the ground is fertile for those rumors, you might have some other problems with acceptance. But the acceptance in Nigeria has changed dramatically.
And you've engaged with local religious leaders, local political leaders.
It's been a series of things that have done. The political commitment at the highest level, the religious leadership at the highest level of the entire Islamic world has been extremely supportive. The religious leadership in Nigeria has been extremely supportive. They have issued fatwas, they've issued edicts, religious edicts. But the most important thing is that communities have been engaged. Communities have been engaged through a structured dialogue. People have a platform to air their views, to share their views. And that does not allow rumors to prosper.
And it's a good base for continuing the fight.
Yes.
Thank you very much, Naveed, for the update.
You're most welcome.
Join us after the break when we look at a global push to eliminate an ancient affliction.